healthcare professionals are professionals. That means they have responsibilities to work within their own system of beliefs and values. In some situations, there are things that a professional cannot do to a patient, even if the professional believes deeply that's the right thing to do. At one extreme, you can't actively kill a patient for mercy, even in some unusual interpretation of your professional responsibility. You believe that's what would be best for the patient. It's just illegal, as well as immoral, but setting aside the moral issues, you've broken the law if you mercifully kill a patient. So you can't do that no matter what your professional conscience is. At the other extreme, you cannot intervene to preserve a patient's life without the patient's consent. Even though you feel deeply that that's the morally right thing to do, you may have to simply withdraw from the case. Withdraw from the case by getting another competent colleague who's willing to care for that patient. So there are limits on how you can follow your professional conscience. On the other hand, professional commitments may guide the advice that you want to give to a patient, may help you formulate a set of beliefs about what you think is appropriate. If the patient refuses your advice, you are obliged, morally and legally, to honor, show respect for that patient by not treating against the patient's will. On the other hand, if I as a patient come to you and say, okay, here's the plan, here's what I want you to do. I want you to give me a deadly drug because I'm ready to die, or even do some radical surgical procedure that I've read up about and I think it's a good idea. You're under no obligation in the normal case to do whatever the patient demands of you. It's your role as a professional to form your conscience and to honor the patient's request if it seems like an appropriate and fitting request. But at some point you say, no, I can't do that in good conscience. And generally it's legal for the health professional to refuse to deliver such treatments. There are a few exceptions, but generally that's what's required.